everyone for joining us this morning. I am Representative Peggy Scott from Andover, which is in District 35B. And also on the call this morning, in addition to Senator Michelle Benson and Representative Sandra Erickson, who will be speaking, we also have Representative Ron Kreischer, who's the Republican lead on the Education Finance Committee in the House. And then also we have Representative-elect Bjorn Olson and Representative-elect Patty Mueller she's going to try to join us. Both of them are teachers currently, and so I wanted to have them here as well. There's Patty, Representative Mueller. So with that, for the context of this press conference, I represent the largest school district in Minnesota. And I hear daily from our parents about the impact that the lack of in-person learning is having on their children. And these stories are sad and they're very real. We are here today to talk about a bill that will be offered by House and Senate Republicans that will allow teachers and school personnel to be considered essential after healthcare workers, those in long-term care facilities, the vulnerable. So kind of that first round, folks, we want the teachers and the school personnel to follow up on that. And I want to just emphasize here too, that this is no mandate that a teacher would have to get a vaccine. It would be voluntary, as they all should be. We all have friends and family that have kids that are struggling with not being in school. Our students are falling behind academically, and for many, their mental health is spiraling downward. Distance learning is just not the same. Kids need to be in the classroom. They need their teachers. But teachers and kids need to be safe. And this bill would help in getting schools back open both safer and sooner. So with that, I would like to introduce Representative Sandra Erickson, who is our lead on the Education Policy Committee. And she's a former teacher. And so she's going to speak a little bit to what we do know as far as what's happening with students academically right now under this distance learning. Go ahead, Sandy.
Thank you, Representative Scott, and welcome to this press conference that really pays attention to what's happening in our public school system. If we could accomplish this proposal in the legislature, it would mean that we take away the fear that our children have of this COVID, and I think for our teaching staff as well. We have across this nation more than 76 million children enrolled in public schools. Here in Minnesota, we have about 900,000. And when you think about 900,000 students being left behind to a great extent, we have to fear for our future. One research report that I have read says that there could be as much as a $10 trillion shortfall or lack of revenue for these children in their future if this continues. So it's really important that we consider this proposal. As Representative Scott said, it's not a mandate. You probably remember that CARE 11 carried a story that indicated that 40% of the grades that were given out in the St. Paul Public School District were failing. And another piece of data too that's really concerning is the number of students who are not checking in or are checking in and checking out. And so their attendance is not counted. And one of the ESSA requirements in the nation and in Minnesota is consistent attendance. And consistent attendance has fallen in the urban areas to be dismal. I mean, in Minneapolis and St. Paul, it was before the COVID down to 70%. So you can imagine what it is now. Our children need our teachers, and our teachers, as I was once one of those for almost 40 years, know how important it is to interact with children directly. That face-to-face cannot be taken away. It is part of the lesson that is presented, the skill that is taught, the knowledge that is conveyed, but then there comes along repetition because some learners can't learn at the same speed as others, and then reinforcement. Every child needs reinforcement. I have observed the distance learning with my grandson, and know that we need to get back to the classroom. His teacher does an amazing job. He's a fourth grader, both of his teachers, but still there's not that real communication that we need. So I want to emphasize again that teachers are so important. If we can offer them the opportunity to be vaccinated and get back in the classrooms, maybe we can begin to catch up. This is so disconcerting to me that we are doing this to our children, that we are leaving them behind and not figuring out a way, because the public school system was never equipped to come to grips with this kind of situation. And so we have to face reality right now and try to get our children caught up. So offering this opportunity for vaccinations for teachers and administrators and school personnel who are licensed to get in line for the vaccination is really important to all of us. Thank you.
Thank you, Representative Erickson. And I also want to acknowledge that also joining us right now is Representative Dean Erdahl, who also is a former teacher, and welcome to the call, Representative Erdahl. I'd like to turn it over now to Senator Michelle Benson. She's the chair of the House and Human Services Committee in the Senate, and she literally spends hours a day on COVID issues. And so she, I believe, is an expert in this area. And so after that, we will hear from a teacher, a parent, and a student that have been obviously affected by the lack of in-class learning. So Senator Benson, welcome. Thank you for being with us.
I'm glad to be here, and thank you, Representative Scott and Representative Erickson, for your leadership on this issue. Minnesota families have been incredibly impacted by COVID and the impact of distance learning. They are stressed as they try to parent, work, and educate in partnership with teachers. They're teachers in my family, and so this is really personal to me. I want them to be able to do their job well. As someone who has friends across the spectrum, everything from homeschooling to children with special needs who have really intensive IEPs, I want children to have what they need as well. With limited availability of this vaccine, it's going to be important that the Minnesota Department of Health prioritize those things that are most critical to Minnesotans. And I completely agree, Tier 1A, our healthcare workers and those who are vulnerable. But then as we start to make decisions about the next tier, I think teachers need to be really high on that priority. And I agree with Representative Scott, it needs to be informed consent and voluntary. And I think it should be prioritized where those kids, as Representative Erickson raised, where those kids have had the most detriment from distance learning. And so I sent a letter to the Department of Health and Department of Education yesterday. I have raised this through phone calls earlier, but it is important that legislators on both sides of the aisle, first of all, acknowledge the importance to our families to have a stable, functioning education system in person. But more importantly, I think, to acknowledge that special ed kids are falling behind, that those children who are already impacted by disparities are falling further behind. Children with English as a second language are going to be even further behind in their success. And as someone who deals with pediatric mental health and health and human services, I can tell you our children are experiencing more depression, more anxiety, more ideation of suicide. It is critical that we give them some sense of normal as soon as we can. And so I thank Representative Scott and Representative Erickson for their leadership on this.
Thank you, Senator Benson. And now I'd like to turn it over to some members of the community. And first up is a math teacher. And that person is also a football coach at Andover High School. So welcome, Tom DeValis. I hope I didn't botch your last name, but I know you'll correct me. Thank you for joining us, and go ahead with your story.
Thanks. My name is Tom DeValis. I've been in education for 22 years, both as a teacher and a coach. All 22 years have been spent in the Anoka-Hennepin School District. And what I have done over the last few years is kind of moved around within our school district. And so I started out at Blaine High School. That when you're looking at Blaine High School, I think it's a great mix of students. That we have kids who are, as you had mentioned, kids who are in needs of special education services. You have kids who are in need of English as learning language students, kids who are coming from areas that are very low with free and reduced lunch, to other kids who don't have that. I then moved on to Coon Rapids High School, where Coon Rapids is very different. Coon Rapids' population is high in free and reduced lunch. And, when you're looking at that and you're looking at what availabilities are and comparing that out to where I am now at R-Andover High School, that is very different. R-Andover High School in our district has the lowest free and reduced lunch rates. And so for me as a teacher and as an educator, somebody who also was in athletic administration, what you see and you hear a lot about is that gap in achievement. And what you're noticing is that right now with COVID, with kids on distance learning, that gap is only increasing. Because when I'm thinking about the students who are coming from homes and from areas that they don't have the resources, their education is very different than the kids who are in class. If I'm a classroom teacher sitting here with all 35 of my students, I can give kids the same experience. I can give them the same love, content, and description that I want to give them because I have them here in person. When they're in distance learning, I'm requiring that they have to have the same availabilities, and they don't. Some kids have laptops. Some kids have computers hooked up to 32-inch monitors. Other kids have cell phones that they're looking on a 5-inch screen, and they're trying to follow along off of there. There's other kids who they're choosing to have that option where they can check out when they want to. Having the ability to coach this fall was awesome. Having the ability to get in front of kids on a daily basis for a lot of those kids was a saving grace. It gave them an opportunity to get back to normal. And I want that opportunity for all my kids, not just the kids who are in sports and who are in activities. I want that for every single kid to be able to get back in here, because I said it a lot to our football players. I think this society of kids is going to learn a lot about their resiliency. I think they've been very resilient over change from what's happened to March until now. But I think what also has happened is that our kids have had the ability to check out when they want to. They have the ability to turn off their screens. They have the ability to mute their microphones when they want to. And as they get older, what is that going to do to them and do to our state and do to our society if they choose to mute conversations and if they choose to check out of conversations? And so I fear for our future that the longer we wait to get kids back into school, the longer this impact is going to have on our society. The other thing that I'm going to end with is, for me, one of the big things that come into how I teach and how I coach is relationships and my purpose and what it is and why I do what I do. And a couple of weeks ago, I always think things happen for a reason. And a couple of weeks ago, I heard a phrase that said, if you know your why, it makes it easier to find your way. And for me as an adult and me as an educator, I know my why. My why is to impact kids. It's to impact students' lives. Because at the end of the day, what I care about is 20 years from now, what kinds of adults they become, how they're contributing back to our society and what they're doing to help us. The kids need to find their way. And as educators and us in schools, we're helping to do that. So whether it is through my math class and they become engineers or they are going to an orchestra class and they're becoming a musician, whatever that is, that purpose, their way, they need to find that way. And so that they can know deep down that they're doing what they're supposed to be doing. And I think the longer we wait for that, the longer we're going to have. And I know that it was already stated about, what we're looking at from the standpoint of financial purposes, but the mental health pieces is what worries me the most. We're finding ways for kids right now. Kids find it easy to not be engaged, to be by themselves, to be in solitude. And that's not good for them. It's not good as we look into our winter where you wake up and it's dark and not too much later, it's dark again. They need each other. They need adults. They need people around them that are constantly telling them that they matter, that they love them, and that they're here for a reason and a purpose. And so if we can get them back in school sooner, that's only going to increase what great things these kids can do for us in the future.
Thank you, Tom. I really appreciate your perspective. And next we have a parent of two, Carrie Smith. Welcome, Carrie. Thanks for being with us.
Thanks for letting me speak. I'm not a great public speaker, so I'll probably be reading most of this. So, but anyway, my name is Carrie Smith. I'm actually a nurse practitioner, and I've been that for about 20 years now. And I've been working throughout the pandemic, caring for the physical and emotional needs of many of my patients. And I understand what it's like to treat COVID patients on a daily basis. But today I'm speaking to you as a mom, a working mom of 3 wonderful kids. And I want to speak up for my kids, for the kids I see in my clinic, and for the kids of my coworkers and friends who are struggling with distance learning. This is not working for so many, and they need to get back in person with their teachers. I have a 16-year-old who is managing okay, logging in and getting things done. But I have a 14-year-old son that is really struggling. I can't monitor him on a daily basis when I'm in the clinic. I can't leave my patients during the day to check on to see whether he is logged in into the classroom. After working all day, I try to help him with lots of missing assignments, but it's not the same as his teachers. Kids like mine are old enough to stay home, but need the structure of being in school to help meet their academic, social, and emotional needs. I can't imagine having elementary kids and trying to do this. There are many days my son doesn't leave his room until I get home during the day, completely disengaged from his whole life. The isolation of our children has so many consequences. Teens depend on social media now for interaction, and they aren't living real lives anymore. They need real connection with their friends, teachers, and coaches. I have parents bringing their children into my clinic worried about anxiety, depression, and suicide. In a normal year, my children are involved in sports, music, and church activities in addition to school. There is balance between school activities and home. This year has been totally different. School and peds are home, music is unfulfilling, sports has been canceled, and kids are suffering. I'm trying hard to juggle it all and meet the needs of my family, but it isn't working. Schools need to be open as soon as possible. Humans need connection, not only from our parents, but from friends, teachers, family, grandparents, etc. Teachers play an important role in the development of our children. My oldest daughter is 21 and in college. She still has 2 to 3 teachers and coaches that she is in contact with and asks for advice. She too is struggling with distance learning. While she was home recently, her younger sister was in a video class with her favorite Spanish teacher. Serena, my oldest daughter, surprised her Spanish teacher by popping in on the screen saying, "Hey, Schiff." The excitement on her Spanish teacher's face when she saw Serena brought tears to my eyes. Those connections cannot be formed on a video screen. Please help get our kids back in the classroom where they belong with their teachers and help keep our teachers safe. Thank you.
Thank you, Carrie, for telling your story. I appreciate it so much. Finally, we have a student from Anoka High School, Grant Higgins. Thanks for joining us this morning, Grant.
Hi, my name is Grant, and I'm a senior at Anoka High School. I'm president of the National Honor Society. I'm involved in student council, football, band. I shot trap. So I know people from all walks of life, and I've seen a lot going on right now. And I feel like it's my responsibility as a student and as, a member of this community to let you know what's going on. Social media, as said before, everyone's communicating through that now. And it's kind of sad what we're seeing on there. Students are isolated and lonely. They're feeling depressed and anxious, and most are just struggling to get through their day. And no kid should have to do that. I even don't feel like myself sometimes. It's just a melancholy clock in, clock out. Every single day is the same. I know things will pass eventually. This vaccine will get out, but we need to get on this now for education and our futures. Because we're going to be, impacted by this forever. Being in high school, as president of the National Honor Society, I've had students in and outside of the organization reach out to me, all struggling and concerned about their grades and their future, because high school leads to college and college leads to what someone's going to do with their life. So right now, we're being impacted forever. Yesterday I had one of my close friends send me a video on Snapchat of her crying because she failed math, and she's a smart kid, but just the way everything has been, it's been so hard for so many people to get motivated. And this is just not a fair way to learn. I'm an ambitious student, and I had to withdraw from a PSEO class because some things aren't meant to be learned online. You can't read a textbook and magically learn physics or calculus. You have to be there. We need the bond with our teachers. We need to be able to learn. You can't learn through a screen the same you can in person. It's not a proper education. And people know this because last trimester for high school, we had, kids could choose to have their classes not go for grading and not go on their transcript. Currently, we didn't have finals, and these adjustments are supposed to make it easier, better for us, but that's just limiting us. That means that people know this isn't a real education, and this is going to last forever. While things will pass, people will get better. Some people could have serious mental damage, and some kids could have their whole futures shaped. This is why we need teachers to be there for us, to teach us. I work as a nursing assistant, a dietary aide, soon to be nursing assistant at Mercy Hospital. And I'd give up my vaccine to give it to a teacher so I can get myself and my peers back in the classroom. And all of these are reasons why we must support our teachers and why we need to get kids back in the classroom.
Thank you, Grant. I appreciate all of the members of the community for being here today. I know you have busy schedules and some of you may have to leave to get back in the classroom. So with that, I would open it up for questions. David, if you want to take over from there, I'll let you do that. So I'll put myself on mute, and if there are questions, let us know.
Yep, sounds great. Our first question will be from Mary LaHammer. Go ahead, Mary.
Thank you. I want to start with the representatives and then talk to a student and teacher, but starting with the representatives, I'm guessing you noticed this as well in the budget forecast, that there was a quantity attached to the number of kids who are gone out of the public school system, that the state spending is down by 12,600 kids for sure. What's your sense of, could that number be 2-3 times bigger of kids that have completely dropped out of the system and are missing in action, and what the ramifications of that could be?
So I don't know if Sandy or Ron Krisha, if you want to take that.
Yeah, is Ron with us?
Yes, I am.
Will you take this one, Ron?
I certainly will. So thank you for the question. And the answer is we don't know. There's a lot of anecdotal pieces out there, and we're hearing lots of stories. But this is why it's so important, frankly, that we start to have some hearings and we start to look at the actual numbers coming in, what those student enrollment numbers are, so that when we get to February and we start to make our projections and our budget together, we actually have numbers. But while we may not quantitatively be able to say exactly how big the problem is, what you've heard today is that the problem's pretty large and that it is affecting students, it's affecting teachers. And this is a generational problem that we're going to see for years to come as these students are trying to recover from a very difficult learning environment.
And could I maybe go to Tom, teacher, coach? Do you have a sense if there are kids that have, just disappeared and you don't know for sure if they're really homeschooling or if they went to private school? Are there, athletes, students who you think have disappeared?
I think there is. And I think the same thing of the ramifications down the road is yet to be determined. I think just like everybody household, they have to do what's best for them and their families and what that offers to them. I think no matter what, you having in-person teaching, regardless of what that looks like, is the best for kids, because that's how you have those connections that are made.
And again, do you know personally of any students or any athletes that just have disappeared and you're not sure where they are?
I haven't had any that I've had from like my list of athletes that haven't come back into the public school. I know that there's a percentage within our school that are no longer here, and whether it's gone to a private school or they're doing homeschooling of some kind. I just haven't had those athletes. All of our athletes that I've been exposed to have come back to us.
Okay, great. And Grant, anything you
And-
want to add about this, about if you have classmates that you just don't know where they are and, you know, kids.
And I'm sorry, Ms. Loehrke, and
Yeah.
I just want to jump in here quickly before the student, because what we just heard there, and let's make no mistake, even before COVID and distance learning, there are many kids that we haven't been able to get to. There have been many kids that have just disappeared for whatever difficulties in their home life and socioeconomic. What I think the important point to point out is that group has just gotten larger. It's not gotten smaller. And, you know, we had a very bad situation before with the achievement gap and so forth. This is just making it worse. So I'm sorry, I didn't mean to jump in before the student, but I just wanted to get that point out.
Thank you. Yep. And Grant, can you add anything to this? Of, you know, of social media, you're hearing about kids who went to private school, who are homeschooling or who just disappeared.
Yeah, you know, some peers just have been too frustrated with, you know, learning like this, and they've just given up on their futures. They've stopped showing up to class. Other families, you know, again, with, you know, that class divide almost, kids have had to, you know, if they're lucky enough to still have a job, they've been working more hours to try to support the family and, you know, pitch in like that. And yeah, it's crazy how many people are just not getting what they need right now and are just choosing to give up instead.
And Mary, I would just say that my best friend is a teacher in a high school, not in Anoka Hennepin. And she is saying how many kids don't even log in every day. They don't even bother logging in. And, you know, she can make so many phone calls to their parents and to their homes, but it's super frustrating for the teachers too, because they're trying to reach out to these kids in a limited way. And it's not working.
If I could follow up real quickly, do we have any sense of scale? You know, the budget forecast showed us 12,600 gone, but could it be tens of thousands? Could it be hundreds of thousands? How big could this scale be of kids that are just not in the classroom?
Well,
Right,
I think this is
ahead,
Representative Erickson, and the department has to be collecting data. And I have frequent communication with them, asking them if they're collecting data. And I really don't think that they're collecting the data they need to. You know, in law, we have certain hours that have to be accomplished for grade levels to get financing. We also have numbers of days, and I just don't think the department is collecting that data, or at least not telling us about the data. Maybe because, you know, they too are fearful of the ramifications of 45 days last spring. And now we're over 45 days this fall. I mean, that's going to be 3/4 of learning and attendance and checking in, and children who don't have anyone at home aren't checking in. I'm sure of that. I've watched it as my grandson has been on distance learning, and children aren't checking in, and that's at the 4th grade level. So we know this is concerning, but the department has to be collecting data, I hope, to assure us that we know where these students are and that we're taking care of them in some way.
Okay, thank you.
Okay, next we have Brian Baxt from NPR. Go ahead, Brian.
Hi there. Thanks for doing this. Do you guys have any sense as to how many teachers we're talking about here? There's 58,000 plus public school teachers. We don't know necessarily how many private school teachers. Would this apply to no matter what your teaching setting is, and would it apply to higher ed? What can you give a sense of scale on what this proposal would cover?
Well, in the proposal that I'm chief authoring, that'll be introduced at the special session coming up next week, we define school administrator and we define teacher. But, you know, in law, we have control over public education, not private or parochial education. So I would think that that would be something we would have to consider as an amendment if we're going to offer that. But, you know, vaccinations will be voluntary for anyone who seeks them, who has a need, I would guess, after we have done the essential and critical workers and industries, and also the at risk. So I think that is a question that's still up in the air.
And this is Representative Creasy. I wonder if I could just jump in with that quickly. Brian, thank you for the question. One thing I'd like to point out is what this bill does from Representative Erickson and what Representative Scott is advocating for is that we actually just bring teachers to the table and start talking about this. If you look at what the governor's steering committee on how the vaccinations are going to be, he didn't even have a representative for how that would happen from the teaching field. And we need to quit talking about teachers and do what we've done on the Republican side, which is talk to teachers. And the reality is we need to bring them to the table and figure out how big and how fast and how many need to have the vaccination so that we can get kids into school safely and in a speedy fashion.
And some of your leadership has been briefed. Perhaps you guys know what this vaccine rollout plan looks like, because some of the senior leadership will be with the governor this afternoon. Do you know where teachers are? And is there any concern about starting to put occupations in law or, passing bills? Because there are other occupations that have already stepped up, firefighters and other frontline first responders who say that they should be early on as well. I mean, at some point, somebody's got to be toward the back of the line.
Well, I'm just going to jump in here. This is Representative Erickson. We consider, teachers, administrators essential, but you're right, there will be others that come forward. But I've noticed that both NEA and AFT, which are the two major teacher union organizations, have come out promoting vaccinations that are voluntary forced teaching staff. So maybe if they get more engaged, we'll hear more about this. But you're right. There are going to be many groups. Should they be named in law? I'm not sure at this point, but at least as Representative Crecia said, we've got the governor thinking about it and we've got people talking about it, and we certainly have legislators engaged in this question.
Senator Benson.
If I could, Brian, there is tier 1A and then tier 1B, and I believe teachers are in tier 1B, but the list in 1B is quite long. And with respect to first responders, the reason I chose to move teachers up is because I've seen the mental health impact this is having on our kids, and in particular, the stress on women who are trying to juggle being distance learning partners with teachers and maintain their profession. We've seen a significant step back in some families of the impact it's going to have on their careers. So there is a rollout plan. There's going to be limited access to this vaccine, and there's going to be limited access for a long time. And the Minnesota Department of Health, in coordination with the CDC, will be setting priorities for the state of Minnesota. And I think us adding our voice to say that teachers need to be higher on that 1B list rather than lower is an indication of some of the stress that Minnesota families are under. And it's not that other folks aren't important, it's that we don't want this to be missed.
Could you ballpark how many occupations or demographic groups are in that 1B segment?
I'm not going to ballpark because there is an official list. And I don't have it with me right now, but I bet that's something we can get from MDH. If you want to reach out to Ryan in my office, I know it was on a slide I saw last Friday.
And I think this is an important discussion, very important issue. I thank God, Representative Erickson and Crecia for bringing it forward. Without a healthy staff, you can't have school. The of students who are contracting COVID is very low compared. In talking to the superintendents and principals, it's not obviously just the team, it's the support staff as well. If the cooks are ill and can't work, you can't have school. And so I think we need to look at all the staff as much as we can, and remember that great needs out there that our students are suffering, and we can't have staff, and that's why this vaccine is important. Thank you.
We legislators have a Zoom tonight with Madeline Horman, who's going to update us on the vaccine plan. So maybe we'll learn more then. I'm sure many of us will tune into that.
Okay, our next question is from Theo Keith from Fox 9. Go ahead, Theo.
Hey, everybody. I'm just going to pick up on a couple of questions questions that your answer to Brian's questions created in my mind. First of all, Representative Erickson, Senator Benson, are your bills explicitly going to say that teachers are ahead of first responders? That seems to be what you suggested.
David, we were having a really difficult time hearing him. I don't know if you heard that better. If you could repeat the question.
Sure. My question is, are teachers going to be ahead of first responders in the House and Senate bill? Is it explicitly going to say that?
Well, this is a proposal that is different from others that may come forward. This is a proposal that's for educators only. So it defines school administrator and teacher, and then has a statement about availability. And that would be identified by the commissioner after workers in essential and critical industries are addressed and populations of high risk for severe COVID illness. So we don't make any demands in this. We just lay out an informational, I think, bid for the importance of teachers and administrators or school staff being essential.
Another question for clarity. You say teachers, administrators, and school staff. That covers everybody in the school building? I mean, including the person in the lunch line?
The clause in the proposal defines teacher, and that's a classroom teacher or other school employee required to hold a license from PALSB, which is our Professional Educator Licensing and Standards Board. So no, when I say staff, I'm talking about those who are licensed. And the same is true of school administrator. That's a principal or other person who has general control and supervision of the school. So that would not include those other employees in this proposal.
Okay. Do you know how many people have those licenses total statewide?
Well, I think altogether we have 72,000 licensed staff in Minnesota, and I think we have about 65,000 who are not licensed. We have, a lot of paraprofessionals and other school employees, so we do have a huge school population of staff if we look at it broadly. So it does number many.
Representative Erickson, correct me if I'm wrong, but I believe the proposal does address paraprofessionals. I just want to point out too that this bill is a baseline. This is a discussion starter. Yes. And what we're trying to do here is emphasize the importance of getting schools open sooner rather than later. And we see this as a first step in making that happen so that kids, as I said, and teachers can get back to school safely and sooner.
Yes, and I need to be corrected. Paraprofessionals are listed in subdivision 2 of the vaccine availability. School administrators, teachers, school administrators, and educational paraprofessionals. So I stand corrected. Thank you.
Okay, I believe our final question, or the last person on the list for now, is Shannon from Senate Media Services. Go ahead, Shannon.
Hi, everybody. I'm just curious, what's the timeline then if this were to pass? And first off, is the plan to introduce it in the next special session? Is there a conversation among members of the DFL? And then the timeline in terms of how long until the kids get back into the classroom?
I'll just start by saying that I'm not on Twitter, but I've heard and seen the screenshots of a couple of Democrat legislators that are in agreement in prioritizing teachers and getting our kids back to school. I will let Senator Benson address more of the timeline issue. She knows more about the rollout of the vaccines and so forth.
And just to be clear, the Pfizer vaccine is likely to start shipping on the 11th. The priority will be to hospitals. They have smart crates, essentially, that will accommodate a hospital level vaccination. And then there will be next steps. There'll be smaller packages sent to Walgreens, CVS. They will help with long-term care. I don't know when we're going to have enough production. I haven't looked at all of the vaccines and all of their timelines. But let me just take this moment to say the Pfizer vaccine hasn't gone through clinical trials for 12-year-olds to 18-year-olds, and it hasn't gone through clinical trials for 6-year-olds to 12-year-olds. So we're not talking about children being vaccinated for quite a long time. But the sooner we get, and I would, if I were the primary decision maker on which teachers get vaccinated or have vaccines available to them, those schools with the biggest disparities and the longest distance learning would be my priority, so that we can help the kids who have been out of the classroom the longest and have the most backslide happening. That would be my priority. And I don't think every bit of this needs to be written into legislation. The Minnesota Department of Health is going to manage our vaccine rollout and work within CDC guidelines, and they're going to make choices, want to be part of the decision making on where those choices get made and who is a priority.
Thanks, great.
That's all I have for questions. So if you want to wrap it up, Representative Scott, we'll get this wrapped up.
Sure. Thank you all again for joining us. Thank you for everyone on this call. And let's hope and pray that that teachers and school staff are included in that second round of vaccines, so that we can get our kids and our teachers back in the classroom safer and sooner. Thank you.